Well, your kids' dental health starts at a very young age. Recent research finds that overall rates of tooth decay have gone down over the years, except for kids. It's actually gone up. And Dr. Stephen Tan is here today to discuss this with you. Thanks for coming in.
Thank you for having me.
We're not taking good care of our kids when it comes to their teeth, are they?
No, not really. I mean, recent studies show that tooth decay is really increasing, and fatalities from tooth decay can increase as well. So we want to make sure we bring our children in to see the dentist at a very early age.
So when should you start? Like when they get their first tooth? Do you wait for them to get several?
Well, we really recommend when they first turn one at the first birthday. But when patients come in, you generally see them at any age, but really recommend them to come in on the first birthday.
Okay. What are some of the pitfalls to watch out for kids? Like I learned my kids have deep grooves apparently, and raisins were not a good idea. And here I thought I was being such a healthy mom giving them raisins, but that was creating other things like that, little surprises that we should know about.
So basically foods with a sticky consistency generally increase dental decay. So obviously anything with sugar in it is very, very bad for our kids' teeth. So we want to stay away from sugary foods. We want to stay away from foods that are very sticky, have a weird consistency to it. But we do want to, of course, go towards dairy products, towards products with fluoride in it. Those are generally better for our children's teeth.
Make sure that they have fluoride water as well.
Fluoridated water.
What about those that put their babies to bed with a bottle?
Right.
Not a good idea?
No, not a good idea at all. So we want to make sure that for infants, we want to stay away from the bottle if possible. It can definitely lead to an increase in tooth decay. Parents often put in a sugary item like juice in the bottle, and when the child goes to sleep with it, it's a constant 8 to 10 hours of sugar in their mouths.
What about jumping to when they get older? There's so much pressure to have nice white teeth, and you see teenagers wanting to use these whiteners. Is that a good idea at a young age, or when is it safe to use?
Well, whiteners, I mean, that discussion really depends with your general dentist and with the child's dentist. So you want to make have that conversation with your dentist in terms of when to whiten their teeth. Obviously, the main concern is making sure that they do not have cavities, because that can definitely lead to systemic issues as well. So we want to make sure that the primary emphasis is on good oral health care, hygiene, and prevention.
So you got to teach them to floss at an early age, which can be a little bit of a challenge, although they do have those handy little flossers for little kids that are shaped like dinosaurs and various things, right?
Anything shaped with a dinosaur is great.
They love dinosaurs.
With the mermaid, with the race car.
Now you're talking.
So any of those are awesome. On your toothbrush, on your little floss threader. Those are great ways to engage your child into brushing, making it a fun activity.
Okay. So. Dr. Tan, thank you for coming in today.
So
something to think about.